Hello everyone, welcome again on the YouTube channel of Chameli Devi Institute of Pharmacy, Indore. In this session, we will going to continue part 4th of hospital pharmacy, which includes good pharmacist practices in hospital pharmacy. Content of the session would be background of the good pharmacist practice, underlining of philosophy, then definition of good pharmacy practice, requirements of good pharmacy practice, according to these conditions would be applied, then settings, standards for good pharmacy practice, and conclusion. So here is a background of good pharmacy practice where it is developed. So under the World Health Organization, revised drug strategy adopted by the World Health Assembly in 1986, WHO organized two meetings on the role of pharmacists in Delhi, India, and in 1988 in Tokyo, Japan in 1993. This was followed by the adoption in May 1994 of the World Health Assembly Resolution WHA 47.12 on the role of pharmacist in support of the WHO revised drug strategy. In 1992, the International Pharmaceutical Federation, which is FIP, developed standards for pharmacy services under the heading Good Pharmacy Practice in Community and Hospital Pharmacy Settings. Now, what is the underlying philosophy behind the GPP? So, the mission of pharmacy practice is to contribute to health improvement and to help patients with health problems to make the best use of their medicines. There are 6 kind of components to this mission, which is being readily available to patients with or without an appointment, identifying and managing or triggering health-related problems, health promotion, assuring effectiveness of medicines, preventing harm from medicines, and making responsible use of limited healthcare resources. Definition of good pharmacy practice. So, good pharmacy practice is the practice of pharmacy that responds to the needs of the people who use the pharmacist service to provide optimal evidence-based care. To support this practice, it is essential that there be an established national framework of quality standard and guidelines. Requirements of good pharmacy practices. So, good pharmacy practice requires that a pharmacist first concern in all settings is the welfare of patients. After that, it is also requires that the core of pharmacy activity is to help patients make that the best use of medicines. Fundamental functions include the supply of medicines or medication and other healthcare products of assured quality, the provision of appropriate information and advice to the patients, administration of medication when required, and the monitoring of the effect of medication use. Third one is good pharmacy practice requires that an integral part of the pharmacist contribution is the promotion of rational and economic prescribing as well as dispensing. Other than that, good pharmacy practice requires that the objective of each element of pharmacy service is relevant to the patient, is clearly defined, and is effectively communicated to all those involved. Multidisciplinary collaboration among healthcare professionals is the key factor for successfully improving patient safety. In satisfying all of these requirements, the following conditions are necessary. That is, the well-being of patients should be the main philosophy underlying practice, even though it is accepted that ethical and economical factors are also important. Then, pharmacists should have input into decision about the use of medicines. A system should exist that enables pharmacists to report and to obtain feedback about adverse events, medicine-related problems, medication errors, misuse or medicine abuse, defects in product quality, or detection of counterfeit product. Then, the relationship with other health professionals, particularly physicians, should be established as a therapeutic collaborative partnership that involved mutual trust and confidence in all matters relating to pharmacotherapy. In reality, organizations, group practices, and pharmacy managers should accept a share of responsibility for the definition, evaluation, and improvement of quality. The pharmacist should be aware of essential medical and pharmaceutical information like diagnosis, laboratory test results, and medical history about each patient. Obtaining such information is made easier if the patient chooses to use only one pharmacy or if the patient's medication profile is available. The pharmacist needs evidence-based, unbiased, comprehensive, objective, and current information about therapeutic medicines and other healthcare products in use, including potential environmental hazards caused by disposal of medicines waste. Then, pharmacists in each practice setting should accept personal responsibility for maintaining and assessing their own competence throughout the professional working lives. Other than that, educational programs for entry into the profession should appropriately address both current and possible change in pharmacy practice, and national standard of good pharmacy practice should be specified and should be adhered to by practitioners. Setting standards for good pharmacy practice. So it includes standards that often exceed those laid down by national legislation. Furthermore, legislation seldom gives precise instruction about how the service should be produced to meet the requirements. Therefore, national pharmacy professionals associations have a role in setting standards required for GPP, which includes a quality management framework and strategic plan for developing services. It is also organized that in developing national standard for GPP, attention must be paid to both the need of the user of healthcare services and the capacity of national healthcare system to support these services. It is recommended that national pharmacy professional associations consider the following roles, functions, and activities for pharmacists where appropriate. Role number 1 is prepare, bowl, opting, store, secure, distribute, administer, dispense, and dispose of medical products. So in these roles there are various kind of functions like prepare extemporaneous medicine preparations and medical products, obtain, store and secure medicine preparations and medical products, then distribute medicine preparations and medical products. Function D is administration of medicines, vaccines and other injectable medications. Then dispensing of medical products and dispose of medicine preparations and medical products. So these all functions are comes under the rule number 1. Second rule under the GPP is provide effective medication therapy management. So there are some functions according to that. First is assess patient health status and needs, then manage patient medication therapy, then monitor patient progress and outcomes, and provide information about medicines and health related issues. Rule number 3 according to GPP is maintain and improve professional performance. So under this function would be plan and implement continuing professional development, full strategies to improve current and future performance, that is, pharmacists should perceive continuing education as being lifelong and be able to demonstrate evidence of continuing education or continuing professional development to improve clinical knowledge, skills and performance. Rule number 4 is contribute to improve effectiveness of the healthcare system and public health. So under this function would be disseminate evaluated information about medicines and various aspects of self-care. Function B is engage in preventive care activities and services. C function is comply with national professional obligations, guidelines and legislations. And function D is advocate and support national policies that promote improved health outcomes. So, conclusion of the session is there are 4 main roles where pharmacist involvement or supervision is suspected by society and the individuals they serve: prepare, obtain, store, secure, distribution, administer, dispense and dispose of medical products, provide effective medication therapy management, maintain and improve professional performance, contribute to improve effectiveness of the healthcare system and public health. These roles may vary for each individual pharmacist depending on their practice responsibilities. Specific standards of GPP can be developed only within a National Pharmacy Professional Organization framework. The guidelines recommended as a set of professional goals to be met in the interest of the patients and other key stakeholders in the pharmaceutical sector. Responsibility for moving the project forward will rest with each national pharmacy professional associations. Achieving a specific standard of GPP for each nation within these recommendations may require considerable time and effort. As health professionals, pharmacists have a duty to begin the process without delay. Thank you everyone for watching this session.